World Diabetes Day is celebrated on 14th November every year. The theme for World Diabetes Day 2021 to 2023 is Access to Diabetes Care. Diabetes is a chronic disease. It is a major cause of blindness, kidney failure, heart attack, stroke, and lower limb amputations. 1 out of 11 people was living with diabetes in 2019. In the same year, 42 million deaths was caused due to diabetes. The burden of diabetes is high in developing countries as 3 in 4 people with diabetes live in low and middle income countries. Even though 50% of type 2 diabetes can be prevented, 1 in 2 adults with diabetes remains undiagnosed. The theme Access to Diabetes Care emphasizes that people with diabetes require ongoing care and support to manage their condition and avoid complications. There are 5 fundamental components of diabetes care. These are access to insulin. Despite the 100 years after the discovery of insulin, millions of people with diabetes cannot access the insulin they need. Access to oral medicines. Many diabetic people require oral medicines to manage their condition. These remain unavailable and unaffordable in many low and middle income countries. Access to self-monitoring. Blood glucose monitoring is a fundamental component of diabetes care, but many diabetic people do not have access to the equipment and supplies they need. Access to education and psychological support. People with diabetes need ongoing education to manage their conditions. 1 in 2 people with diabetes do not have access to education programs. Access to healthy diet and physical activity. Diabetic people or those at risk need access to healthy food and a place to exercise. Healthy food for diabetic people includes nutritious food such as healthy carbohydrates, fiber-rich foods, heart-healthy fish, and good fats. Similarly, being physically active helps the diabetic patient by lowering blood glucose levels and improving insulin sensitivity throughout the body. When people with diabetes can access these 5 fundamental diabetes care, they can effectively manage the diabetes and prevent the associated complications in the future.